This patient was referred to me approximately 8 months ago for endodontic treatment of tooth number 13 and endodontic retreatment of tooth number 14. According to the patient, number 14 RCT was done by her previous dentist a few years back, and patient had pain, and you can see why. There's a large periapical relucency associated with the tooth, and I can already see a missed MB2. I don't need a CBCT. As I said, I can already see a missed MB2, but large periapical relucency, as you can see here. And number 13, of course, you can see large decay into the pulp of the tooth. This is immediately after we redid the root canal on tooth number 14, went through the crown and redid the root canal in one appointment. As you can see, everything went beautifully, and here's the missed MB2. And of course, we were able to address the shortcomings associated with the other canals that were filled short and what have you. We addressed all of those issues as well. But again, there was a missed MB2. When you miss a canal, you leave necrotic tissue and bacteria behind that can eat away at the patient's jawbone. And that had happened. And as you can see, we're able to address it. And here's the date, as you can see, about 8 months ago. This is tooth number 13, so we did number 14 first, then patient came back a few days later, and we did number 13, removed the decay, rebuilt the missing walls, and as you can see, 2 canal systems, and got a beautiful lateral right there as well. And again, about 8 months ago, as you can see right here, when we did our CT of tooth number 13. And in this x-ray, you can see the MB1, MB2, the tubercle and palatal. So again, the dentist who had done the root canal had missed an MB2 canal, and the other canals had filled short and what have you. And we were able to address all of that in one appointment, went through the crown and did all of that, redid the root canal in one appointment. And as I said, here is the date, as you can see, about 8 months ago. And this was today, 8 months post-op of teeth number 13 and 14. And take a look here, that large periapical relucency associated with the mesial root of tooth number 14 is almost completely gone, healed completely. Again, that dark shadow or periapical relucency we call is bone destruction. And you can see after we address the problems associated with the tooth, the missed MB2, removed the necrotic tissue and eradicated the microorganisms, bacteria, her body started to regrow and regenerate bone there. And as you can see, everything went beautifully. Patient has no symptoms, and the tooth is in full function. And here's the date. So you can see in almost 8 months, we have good healing. Of course, we always take bite wing x-rays as well. And patient came to see me for tooth number 21. So she's scheduled to come back so we can work on tooth number 21. You can see decay to the pulp. But the bite wing, take a look at the bite wing here and take a look at this buildup. This is not a crown. The dentist decided to do a composite buildup on this tooth. The mesial is fine, but take a look at the distal. There's a step here. There's a step here. And as you can see, now this patient has a perio problem. She's losing jawbone here because this step has created a pocket, a perio pocket, where food is getting trapped here. Food collects here. Bacteria, fungi, viruses, what have you, start growing on the food. And she's losing jawbone here. So this is no good. This step is bad. This step needs to go. It's causing problems for this patient. Now take a look here. The composite buildup of tooth number 13. Look at this. There's decay, recurrent decay here. And I, of course, confirmed that with my Explorer. And you can see it's kind of falling apart. I could pick on the composite, and this is all the composite that I could pick, and it was just falling apart. it was debonding from the tooth. That's decay, recurrent decay. There's recurrent decay here, and there was recurrent decay on the distal. And I'll show you a video. We took a video also, and show you a video that you can see all of these cavities better. But this tooth has, number 13, has all kinds of issues with the step on the distal and then recurrent decay all around it that her dentist needs to address and fix.
All right, so this is decay right here. That's decay. All right, down here is decay. Right there, that's decay, and up here, if you come up here, that's just that's composite, whatever that is. And look, there's a big catch, and there's decay. This is decay. Right there, there's a hole right here. No, there's a hole here. If you come from the top, you see it. Right there. That's tooth number 13. Thank you.
Here's the pre-op and 8 months post-op of tooth number 14, side by side, so you can see how much healing we got in 8 months. So this is 8 months ago, before we redid the root canal, and you can see that large periapical lucency. And this was just now today, and you can see all of that bone that was eaten away and destroyed by the infection. It has come back. Her body has regrown and regenerated all of that bone. So 8 months ago, and this was today. So you can see 8 months post-op of tooth number 14. So root canals, if done properly, they will work. Endodontic retreatments, if they're done properly, they will work also. You just need to take your time and know what you're doing and do a good job.